Hello, everyone. My name is Dr. James Fletcher, family physician and hospitalist at Bay Health Kent General Hospital and Dover Family Physicians, here with a COVID-19 update for the summer 2024. So as you may have known, there's been an uptick in the number of COVID cases this summer, but do not be surprised. Unlike the flu, COVID is a year-round disease with peak incidence in the winter and in the summer. This July, our peak isn't as large as it was in 2023, but it is matching that same level. Most important things for us to know are how to protect ourselves and who's the most vulnerable. So we'll start with the most vulnerable, those who are immunocompromised. If you have any underlying active cancer treatments, if you have any organ replacements, if you are over 65, you qualify as this immunocompromised group, or if you have any major lung or heart disease, so your atrial fibrillation, heart failure, or your COPD, asthma scale diseases, you're at increased risk for being hospitalized. That's nothing that should scare you. Just a bit of information. Our hospitalization rate is only about 1% nationwide for COVID infections. And if you wonder what strain we're on, we're still in a branch of variants from Omicron. Omicron was the most popular and most virulent COVID strain for 2023. Fortunately, as of this past August, we have immunizations that target that direct category of strains. So if you go to any major pharmacy, you can be immunized, either your Pfizer, your Moderna, or your Novavax. All three are viable for all adults and kids. The thing to be aware of is the two most current variants in that Omicron umbrella, KP2 and 3, very popular in the South and the Western portions of our country. Our organization is just coming back from our Grand Conclave, concluding on July 2nd. That was in the southeastern quadrant of the country, and there was quite an increased peak in incidence of COVID infections. But do not worry, we have antiviral therapies that if you are able to get to your primary care doctor or an urgent care, you can be put on Paxlovid or Lagvrio to shorten the length of illness and prevent that transition to serious disease. So important things that I want to be take-home points for you today. Get immunized this coming fall. All the most popular strains, the ones that are affecting our communities, are going to be targeted every August through that next fall season. Same thing for the flu. The flu incidence is most often August through your May seasons. So get 2 for 1, protect yourselves. And if you live around a grandmother, a mother, a father who's over that 65-year-old age group, who is immunocompromised, who does have a transplant kidney or has recovered from breast cancer, something of that nature, protect them by protecting yourself and getting immunized. Those are the most important things that I want to leave you with today. Although we are experiencing an increased bout of illness, there should not be an increased wave of death, being that we have a lot of protection available, but only 22% of U.S. adults are immunized as of today.
So, Dr. Fletcher, can you tell me how common it is to have COVID-19 and not know it?
It's incredibly common, especially now that we have such a wide population that's been immunized or previously inoculated with the virus, meaning they've been exposed to it. We carry it in our nose. So we're just one sneeze away from spreading it to our local area. There was at one point a great idea to keep that 6-foot barrier around from all of your close peers around you. But for me, that really makes the most sense if you're going to be around that said group for hours at a time. You're going to a concert, you're going to a baseball game, you're going to be a member in the church and the choir is singing out at you. That might be a scenario where there might be an asymptomatic carrier right next to you, and when they hit their high note, you might be infected. So those are the things that I'd want you to be aware of in terms of your susceptibility if you haven't been recently immunized.
Great, great. So following that answer there, so I have a question. If I have been identified as a close contact of a known COVID-19 case, why do I need to quarantine if my nose test was negative?
So good news is as of 2024, the CDC has trimmed down a lot of the guidelines in terms of self-isolation. In fact, if you are yourself COVID positive and you have a fever, that's the only threshold that we really want you protecting your surrounding environment from you. If you've been around someone with COVID and you're testing negative, there's no reason, believe it or not, to restrict your contact with those around. If you were to develop symptoms, particularly the fever, that's when we've found that you're most likely to spread, and that's when we'd want you to protect yourself. The CDC is trying to align our protection strategy with COVID to be the same as how you protect yourself against someone who had any other viral illness. 5 years ago, you wouldn't want a 2-year-old coughing in your face. We still don't want that now.
Yeah, and that's good because my next question had to deal with basically dealing with the difference and being able to tell the difference between the flu and COVID-19. Can you kind of delve into that a little bit more?
So they're both viral illnesses. COVID in its various strains have a couple of hallmarks. The most classic is loss of taste and smell. There aren't many illnesses that take away taste and smell at the same time. Your current Omicron constellation of variants has a lot of GI side effects. So if you're getting a lot of nausea, diarrhea, things in that family, then you might want to think COVID. But the best way to check is to go about testing yourselves. There are a lot of safe and easy at-home COVID tests, far more available than your at-home flu. But if you aren't immunized, that's a great time to go to your doctor to get swabbed there or any local facility that has testing access.
That's great news to definitely take with us as well. I have a question specifically with respect to remdesivir.
Mhm.
First of all, can you talk about a little bit about what it is and then who should get it?
So remdesivir is a novel treatment for COVID that came about in 2020 and 2021. It's one of our greatest tools for hospitalized patients. There's a special criteria to be hospitalized with COVID. The hallmark is oxygenation. So if you have something called a pulse oximeter and you're able to see what your circulating oxygen is, you'd want to see that number over 90%. When it's below 90%, your organs aren't being perfused or getting oxygen at the rate they need to do their job. So if you're below that 90%, you'd want to seek hospitalization. Then we'd administer remdesivir as usually a 3 or 4 day treatment series to lower your overall risk of COVID becoming that serious life-altering disease that could result in need of a respirator, a ventilator, things of that nature.
Thank you, Doc. I appreciate that. So I know myself, I actually had COVID myself, so I did experience some of the difficulties and some of the the issues that come with having that. And I know for some folks, sometimes it may last longer than others. Can you talk about, just I guess the extent of how long some of the symptoms may last, depending on maybe your health and other factors such as that.
So there is a phenomenon known as long COVID. As we've been fighting against this virus over the last 4 years, the long COVID phenomena is not as common as it once was. It was once 1 in 6 people with COVID had symptoms that would last longer than 1 month. Now it's about 1 in 10, but that's still 10 people you line up. One person's going to have long lasting fatigue, long lasting shortness of breath. They could run a marathon. Now they can't run a 5K. The good news is that a lot of these symptoms do tend to wear off over time. But it is novel in that many viruses before this wouldn't take you down a peg for a year at a time. I have many patients that were originally infected in 2020, and the last couple are getting rid of their inhalers and their slow walk to run rehab plans now 4 years later. But a great majority of their symptoms resolve within 6 months. It's the rare 1 in 100 case that's lasting years at a time.
Mm, that's very interesting. And so, we've been going through already a couple of years, through this phenomenon of COVID. Could you kind of talk about, the possible chances of getting COVID-19 twice? Is that something that's real? Is that
With the way that our immunity wanes or weakens over time, it's incredibly likely. Even if you've been immunized perfectly, if you put yourself in places where you can get reinfected in those congregate settings without any sort of barrier mask, it is very likely. And think about the year-long nature of COVID. It's there in the summer. That's when we're most likely to be out at a baseball game. Living fancy free and not wearing a whole lot of protection. Um, the idea of being immunized is also something that you should follow a 10% rule. Every month, you should expect 10% of your protection to wane. So if it's been 6 months since your last shot, you're only at about 40% protection from a symptomatic illness. So it's not a matter of if, but when. If you aren't using the most secure strategy. But if you're not in the most vulnerable group, again, elderly, 65 plus, lung and heart disease, immunocompromised, it's not something you should carry fear from every day. But if you're traveling cross country, you're in airports nonstop, and it's been 6 months since your last shot, you may want to wear a mask. That's the kind of guidance I'd want you to get from this kind of talk.
excellent? So let me go into this. Just for somebody who may think they are immune, should they get an antibody test to see if they are? Would that be something that they would look into?
Unfortunately, the utility of the antibody test has not been proven to demonstrate your level of protection. With the way the variants shift, you could be perfectly protected against KP2 variant, and KP3 gets you the very next day. It's about the variety of people you're around. If you're spending a lot of time in London Heathrow Airport, you're going to have a more varied exposure than if you're in a small town in West Virginia. That would be the idea I'd want you to go home with. You're less likely to be re-exposed and get those secondary infections. But if you're a mover and a shaker and you travel a lot, if you're in that high risk group, you want to carry yourself a little bit differently. If you're 20 to 40 and you have a strong immune system and access to the antivirals if you were to get sick, you shouldn't be much more worried than you were about getting a cold in 2019.
Wow, that's very interesting. So let me ask you this, as a takeaway, what last bullets or just things that you feel that we should know in terms of takeaways? What are the things you feel that are most important for us to take away from this discussion and to make sure that we're doing all we can to protect ourselves from getting COVID again?
So the past is the greatest predictor of the future when it comes to infectious disease. We've seen that COVID tends to spike in that Halloween through New Year's period of time. So I would love for everyone out there who's eligible to be immunized this upcoming fall and winter to protect themselves. And if you yourself don't want to be protected because you feel rather healthy, make sure to get the message to your less safe, more vulnerable elderly populations, those immunocompromised. And if you're going to be spending a lot of time with people in those special categories, protect yourself to protect them as an act of compassion. Those are the big take homes. Every fall should be part of your practice. Get a flu shot and get a COVID shot. That way you're teed up for the times we spend indoors the most with our loved ones.
That is excellent. Definitely something that I'll make sure that I pass along to my family and friends, and make sure that everybody gets to hear this message. Brother Dr. James Fletcher, Sr., I appreciate you for your time and just this message to our audience today. And this is definitely something that is going to help our audience and just make sure that we are equipped with the information and the education to make sure that we can, make sure that we're not do we can do whatever we can to make sure that we do not capture or get COVID-19 again or for the first time. Either way. Thank
Knowledge is power. Be safe out there.
thank you, brother. Appreciate you.